That's awesome. That's perfect. Hello.
Hello,
All
are
of
we
my
live?
friends. I think so.
I'm just still not used to how beautiful this is. Like, we look so legit.
We were messing with it a little bit this morning.
Gosh.
It is a consistent and constant fun battle. It's one of those things that like we'll never be able to just come in and like press a button and go live. We've set a whole new standard for ourselves, and we're like, how can we beat it a little bit more?
So good. It's so good. Good morning, guys.
Good
Welcome to the
morning.
cafe.
Welcome in, William. Welcome in. I am not your traditional normal host. I've cut my hair and I've paled out my skin a little bit, but other than that, welcome into the Medicare Cafe. My name is Benjamin Lavis. I'm an agent resource specialist here at Senior Marketing Specialist. I am joined with
Kari Vote.
the beautiful, the wonderful.
Oh, you're
and
kind.
a huge part of what we're going to be doing today is going through an Ask Me Anything. Kari was actually just mentioning she's got a fun question for us to kind of kickstart. I did, from tuning in 2 weeks ago when you were with Olivia, the conversation of house hunting was I wanted to see if there was any
Didn't happen. No, we're just staying put.
Staying put.
We didn't get our offer, and we're just staying put.
I was
at
curious.
least for right now.
No, that's super fair. I was curious because my wife and I just closed like 3 weeks ago on our first house.
Oh, congrats!
Thank you. Yeah,
That's
it was
so exciting.
Exciting, terrifyingly exciting.
Yeah, moving is terrifying. I don't do well with change at all. I'm
right there with you.
Yeah.
I'll be like, do we really, like, is rent really going up that much? Like, what can we do just to stay put? And it just didn't make sense to not own moving forward.
That's right.
So it was crazy.
Well, good.
I was
Congrats.
curious if you where you guys were in the stages of all of that.
No,
So
we're just staying put.
and that's perfectly good as well.
Yep.
If honestly, I envy you in some of that because we still are living out of cardboard boxes.
I'm sure
I
it'll
can't
be
find
like
my
that.
favorite bowl for cereal, like all that type of stuff. So
Soon.
Wow.
Soon.
Well,
You just need a
perfect.
good weekend to catch up.
yeah, I said that 3 weekends ago. I think it's what it felt like. Every single weekend is supposed to be the next best weekend. Well, I wrote down a couple of different things here, but let's start with the question that you
Yes, I'm
posed.
hoping somebody here has the answer for me because I don't know. I mean, I think I would answer it. I think I know how I would answer it, but wondering if anybody else has experience with this. So I've been doing a lot of underwriting with all the crazy MedSup increases, and I'm getting ready to underwrite somebody, and there's a question on there on all of them that says something about, do you have any like upcoming how do they phrase it? It's like, do you have any upcoming surgeries or diagnostic testings that a doctor told you, you need to have done, but hasn't been performed yet? And she was like, well, I have my like annual mammogram. Like, does that count? I'm like, interesting, because it's not like, that's just like her annual, like she does that every year.
It'd be like a wellness check.
Right.
Almost.
But it's not like her doctor didn't say specifically you need to have it done. It's just every
Right.
So curious. I mean, I'm thinking I'm going to put yes and then just put in the notes that it's just her annual mammogram. But she's just really worried about like getting denied because of that. And I'm like, surely not. Any agents out there have experience with that?
I could see both ways because like you have a scheduled like annual, check-in with your doctor, your primary care physician every year, but that's a schedule that's recommended by a doctor, but I wouldn't necessarily include that in.
Right. And the wording
point.
of this is it's surgeries or procedures. And that's what makes this different because a mammogram is a procedure.
Right.
I think. I don't know.
Yeah, I wouldn't know how else to describe it.
So we'll see.
Yeah.
I'm gonna put yes and then just hope that there's an explanation that I can write. If anybody has any insight, let me know.
I'm gonna jot that one down. If I'm on a carrier call, do you have?
It's like drugs. Just say no.
Our lovely.
But she also was very much like me. If she was like, I don't want to lie. I don't want them to think I'm lying. And I'm like, I don't want to lie either. But I don't think that falls under, the that a doctor wanted you to do more testing.
Right. It would be, I feel like it'd be separate if like blood work came back or
Yeah.
something that was the reason
Right.
for maybe an out of the
Right.
natural or out of the norm
Yes.
procedure or test. I wouldn't think that would cause any troubles, but I also don't know what's the true truth answer. You know
Right.
what I mean? So,
Well, we'll see what
interesting.
happens today.
Yeah, that'll be a fun one. I'll see. I'm also curious just through calling some carriers and stuff the rest of the day. I'll see if maybe I can put that in their ear and
Wonderful.
get you an answer as well.
Test.
Good morning, Michelle. Good morning. Good
Good
morning,
morning.
Eugene. Welcome in, everybody. So, like we were mentioning, today was kind of an Ask Me Anything style, and I wanted to do one of the questions and things that I've been doing with agents has been like a temperature check-in
Okay.
of one, how you are feeling currently and how like what temperature you are set to get to over the next couple weeks. Do you think it's going to get scarier or easier? But then also a temperature check-in for your clients. Like, are your clients,
Yeah.
where are they at? And do you think you can try to diffuse or get them to a set temperature over the next couple weeks, and kind of what your thoughts are on some of that?
I think things were really high last time I was in here
Yeah.
when that big United Healthcare rate increase came out. I would say I'm a little more anxious than normal.
Okay.
Just because my book is so heavy med sup
Yeah.
and all these rate increases. And so I'm just having so many conversations about what do I do? I can't handle these rate increases. And then what's funny though is I feel like it's about half and half. Like half of the people want to make a change.
Yeah.
And the other people, they call me in a panic, like, how can I take this rate increase? But then yesterday, I give them their options and they're like, I'm just going to stay put. I'm just going to stay put. It's too difficult.
It's just $20.
They just think,
it's just $30.
it's just $30. And I'm like, that $30 caused you to call me in a panic.
Yeah.
So it clearly wasn't. So I don't know. I'm having conversations the last month that I've never had in my 6 years.
Wow.
So that's just a little, I wouldn't say it's unsettling. I'm just trying to fast forward to what AEP is going to look like.
Yeah.
Because not a lot, but a few of them have been like, well, maybe let's revisit the Advantage conversation, this
That's
open enrollment.
Kind of what
So
I was curious of, if any of these rates, I know we generally see, especially here in Missouri and with a higher supplement kind of style, being in the rural parts. I feel like Columbia is a middle ground between the two.
Yep.
But I was curious with a heavier book of your nature with the supplement side, like, have we reached that point where a lot of those folks who were gung-ho set of supplements only, I don't want to talk about MA, don't even tempt the idea of bringing it up, what type of shift are you seeing?
I haven't seen a shift in those that are gung-ho. They
Okay.
are still gung-ho for the reasons of, and I have a lot of clients who are in the medical profession, like they were nurses or doctors and so they kind of, what I hear a lot from them are just the frustrations with prior authorizations. And so a lot of them are still gung-ho that they don't want to talk about Advantage, but they want to, we're talking about ends, we're talking about high deductible plan Gs. Like we're doing Mo-GI switches.
Yeah.
So, before, like they loved the comfort of a big brand name of United Healthcare or of Mutual of Omaha, but now they're like, no, I'll take Cigna or Ace, who I've never heard of, and I'm okay with it.
Interesting. I feel like that's one of the big things we always hear is obviously not only selling on premium. There's a huge other parts of whether it's the extra benefits or the name recognition, like you mentioned. So you're seeing more clients are
shopping off of price.
Interesting.
Yeah.
I guess that's not too surprising with how much price has changed.
Yeah.
So it's calling into question some of that. I feel like I wouldn't have anticipated such a quick change, I guess, from something like United Healthcare, AARP, a big name that's recognizable, to being like, at this rate, I'll go with anyone who's got a lower dollar amount.
I think, and I will, it's about half and half of the people I'm talking to. But those that are willing to switch, I mean, I don't know. They're just very different conversations than what I've had in years past. And I think just to the back-to-back double rate increase, high rate increases, that's what they're just like, what is this going to cost when I'm 80. And I'm
No,
like,
for
I
sure.
don't know. I'm like, I'm hoping this levels off at some point, but it might not.
Perfect.
So,
Well, I know. So William mentioned here, I think this is back on kind of the mammogram conversation,
oh,
was it's
yes.
part of the covered annual wellness procedures allowed by Medicare at no cost. It shouldn't make a difference with no history of breast cancer. So hopefully that's maybe
So
a
you
little.
would answer that as no, you don't have any procedures.
We're gonna do this as a class project. What are we putting for this question on the app? And then it looks
Yep.
like I'm actually getting a text in from someone as well. If you could text me your name, just that way I can give you a proper shout out. They're saying that they've always recommended to reschedule the mammogram. That way it's not in a certain time frame, and then the appointments are traditionally easier to get rescheduled. That way, maybe it's
Interesting.
not scheduled.
But the like question doesn't say like, do you have anything scheduled in the next 30 days?
That's
Like
true.
it just says in the future.
Maybe if you just cancel that appointment.
So if you can't, I don't know.
Interesting.
We'll
That's
see.
a couple
That
different
would be because
sides.
she asked that. She was like, well, maybe I'll just reschedule it. And I was like, it's still out there.
Yeah.
So
No,
I
for
don't
sure.
know. Yeah.
I totally didn't do my due diligence. This is the first time I've been on the cafe in a little bit. My text line here is at the very top. So if you have questions or don't have the ability to chat on the YouTube live, feel free to send that text. I have my phone here, and with the lovely help of our producer Sadie, I will be friendly reminded to check that more constantly to make sure no one's getting left behind. So perfect. Yuji mentioned, when will they begin experiencing a double rate increase? I think over United Healthcare is what we were outlining from their
Yeah.
age / then the annual rate increase in June. Is when they were
Right.
seeing
So
it.
like the double rate increase, because United Healthcare has a rate lock for 12 months. Let's say someone signs up in March. So their anniversary is in March. They're going to be rate locked in from March to March. Then they're going to get a rate increase in March on their anniversary, but then they're also going to get a rate increase in June when everybody does. And then, their second year and beyond, it will just be every June. But right after that first year, they're going to get a double rate increase.
It's so
So
interesting.
it just stinks. Whereas like there's it's good to have that rate lock, but it also, I don't know, there's some cons to it. It's just hard.
Yeah.
Because like if you like Anthem, they don't have that rate lock. So if you sign up and do they have a 6-month rate lock?
So I think it's around 6.
Yeah.
And I think what they usually take theirs in September. I want
They're
to say.
January.
Are they January?
They're
I
January.
just been thinking someone else.
Because I'm trying to think. I had somebody who signed up. Yeah, maybe it was May with Anthem, and I'm like, you're gonna get a rate increase in January, and at least I could, I was able to. They were fine with that, but it's just different. I would say I have been telling myself since I've started doing this, that I'm going to have a cheat sheet of what MedSup companies have a rate lock, how long it is, and when their rate increases are. And I've never made it. I've started it multiple times, and I've never made it.
Well, you love the Excel documents. That's how
I do.
Like, your trips are all
Yes.
planned out.
Oh,
So
yes.
interesting. Maybe we can. That might be something that's beneficial. We might. Be
But
able to
like,
piece
do they
together,
ever
too.
change? Like, do insurance companies ever change when they have their rate increases?
How I've always heard it explained is that they generally stick to their annualized schedule, but they have the ability and
To change
freedom
whenever.
to change it whenever.
Right.
So I think, you generally know that
Yeah.
UHC will take theirs in June, but technically they could take it kind of whenever. It just
Okay.
depends on what the market is experiencing. And I think this year's good of example as any to see how
Yeah.
different the market is and how we're really being affected by a lot of that.
Yeah.
So
Well, if you make the spreadsheet before I do, let me know.
I know. I will. I'll maybe make note. That's what I'll pass along as a mother.
Or if anybody out there has a spreadsheet,
Yeah.
please share.
I guess the other part is I would be curious. So last year obviously was hugely different. Was probably the best way to explain it.
Yep.
Were there systems and processes that you put into place last year that you're definitely going to do again this year? Or were there problems that arose last year because of all of the changes that you're going to hopefully try to mitigate with something new?
Last year was the first year that I had to, and I stuck to the 30-minute meetings.
Okay. Was that PDP only or all
It was
options?
everybody except new clients.
Okay.
So if you're a brand new client, I blocked off a whole hour. Most of my meetings don't even go a full hour, though, it seems like these days. But returning customers, clients, I did 30 minutes, and I will 100% do that again.
Did you pre-warn them?
I did.
You did?
Yes.
Okay.
Yep. And the other thing that I will do again is in our newsletter we sent out, we talked about how a review isn't like an in-person review isn't necessary. That we will be doing, me and my assistant will be running, once you get us your drug list, we will contact you and let you know, like, we don't have to have a meeting to tell you to stay
Right.
put.
Yeah.
And so those two things I think saved us a lot of time.
Yeah. I could see that.
And I will definitely be doing that again.
I think setting the expectation too is so key. Like, I know
Yes.
in place of Olivia's seat, like, she's always said that success is basically figured off of or based off of how well you met expectations. And you can definitely sway that one way or another depending on how well you set the expectations with your clients. And so if you can say, hey, as much as I would love to hear about your, your nephew's, cousins, mailman's, dog's soccer game, now is not the time to be able to set that time aside. There's not enough time in the day.
Yeah.
So did you do that via email, phone calls, or how did you kind of set that expectation with your clients last year?
We send out a physical newsletter the first week of September, and then everybody gets an emailed newsletter as well. And then if we haven't received drug lists from people we just start calling and texting, and so they get hit several ways with the information.
Yeah. Do you have like a 3 strikes you're out? Like, if they don't get back to you after X amount of outreaches, then you're like, hey, we tried?
I guess I don't really have a 3 strikes you're out policy, but by the end of AEP, if I see in there we've reached out to you multiple times, like at some point I'm just like, okay, I'm done.
Got to be comfortable with
Yes.
that. Yeah.
Yeah.
You're still a business as much
Yes.
as you want to take care of as many
Yes.
people. You can't be, on, was it Beck and Wind? I don't know. Phrase about waiting for everyone else. So gotcha.
I do what I'm the most excited about this AEP.
Okay.
As you guys know, I only work 15 hours a week.
Mm-hmm.
My children will now be in school 5 mornings a week. So I'm going to have like probably 5 extra hours.
Just to yourself?
Well,
or to the business?
Yeah. During AEP, it'll definitely go to the business. But so I'm sad about that. It's hard to like let go of those, mom strings, but it'll be good because I just also passed my 500 client mark.
Congratulations.
So thank you. So I will need all the extra hours that I can.
I think that's a perfect segue. I was noticing briefly Sadie's question. She was curious on how many of your clients do you expect to change this AEP, if many of them are willing to take the rate increases, or do you think they will change their minds after actually paying $30 for a few months and seeing the impact of that financial change?
I don't even know. I think it's going to be less than what I'm anticipating.
Okay.
Just because I know my clients, and like when I go back to the pros and cons of Medicare Advantage plans and supplements, remember my clients are typically wealthier, and I just sometimes like they get wealthy because they're smart with their money.
Yeah.
And, yes, that $30 rate increase is hard. I think when I just go back to telling them, I think when they see the differences, they will still stick with it. Yeah. Some of them.
That's fair.
So I don't know. I don't have a set number, but I think it will definitely be more than years past, but I don't think it'll be anything dramatic.
And we also have yet to see really how Advantage plans are going to change for this upcoming AEP.
Exactly.
What prescription drug plans are going to look like. I know President Trump just signed an executive order yesterday.
Yes, you said you were reading up on that,
I
and
did.
I haven't had any chance to read up on it.
Oh,
So
it
please,
is.
please share.
It is interesting. I can kind of jump into that. Kay was mentioning, she was the one that mentioned to reschedule. She said,
The
don't
mammogram?
cancel it, just reschedule it. She's been recommending that for 20 years. And has
Okay.
not had an issue. So
Okay.
we've got a little
Thank you,
backing
Kay.
for that one.
Thank you. Good to know.
So some of the executive order that went into place, and obviously this just happened yesterday. So a lot of this is very initial. Please do not pitchfork and torch come after me if I explain some of this slightly, maybe incorrectly. The whole goal of this executive order is to reduce prescription drug costs here in America.
Yep.
And it's kind of twofold. The first and foremost, reducing cost specifically within America.
Yeah.
And then
Because they're so much cheaper everywhere else.
Everywhere. Dude, they used Ozempic as an example.
Yes.
And
I saw that. It
here
was
in the
like
States,
$80 or something.
Yeah. In France, it's $88. And then
here it's $1,300.
Exactly. Well over $1,000. And
Yeah.
it's like, so what they outlined was the twofold. So reducing costs here in the States. But then the second part of that is forcing foreign countries to help manage their fair share of cost. Because right now, since we're paying $1,000 and France is paying $88, the balance is still, we're paying for part of France's
their
Ozempic.
cost. Yeah.
And so
interesting.
That's been a huge part, or at least the conversation. And so the way that they are set to do some of this is to get the United States in what is known as the most favored nation state status.
Okay.
So trying to reach a balance between, okay, well, France is getting it for 88. We want to be closer to that in a most favored nation status.
Is he going after any of the PBMs? Because aren't they a big reason for all of this?
In fact, the United States is the only country
that has
still
PBMs?
allows the PBMs to take up to 50% on
Oh
the
my
dollar.
gosh.
Is what I actually, funny you mentioned that. I found a quote from the CEO of Pharma, and he outlined the following.
So how much do other countries PBMs charge? Didn't say.
It didn't give a percentage or a dollar amount. From what it sounds like is between at least the Europe and the United States, that if we were to get rid of the PBMs, and for anyone who's listening or tuning in, PBM is Pharmaceutical Benefit Manager. So it's kind of a middleman that helps kind of get from the pharmaceutical companies to the consumer. It's kind of that.
And in my opinion, they're the sole reason why drugs are so high.
It is definitely a huge reason as why they are so high. I mean, we experienced that, what was it now, 2 years ago when WellCare switched to Express Scripts, and how big of a PBM change that was, and how much prices, even for someone who was a high value, low cost pharmaceutical or prescription drug company, changed in just a PBM switch. It was really interesting. I remember that shaking up a lot of differences.
Yeah.
But the CEO of Pharma, whose name is Stephen Ubil, I think it is how they pronounce it, they outline, in order to lower costs for Americans, we need to address the real reasons U.S. prices are higher. Foreign countries are not paying their fair share, and middlemen driving up prices for U.S. patients. So the U.S. is the only country in the world that lets PBMs, insurers, and hospitals take 50% of every dollar spent on medicines. The amount going to middlemen often exceeds the total price in Europe. Giving this money directly to patients will lower their medicine costs and significantly reduce the gap within European prices. So,
what would be the timeline of all of this? Did they say?
Great question. So, as of it stands right now, over the next 30 days, our RFK Jr. is set to put into some type of plan and then present that to, I think it's the Commerce. There was a division that has to they will present a plan on how that we can make this work, and then it'll have to go through a couple of other loops, I'm sure.
That would be huge.
There should be some type of plan presented over the next 30
Hopefully
days.
it's figured out before AEP.
Yeah, the pharma pricing.
That's all I want.
What should be set over the next 30 days it's super interesting. And if this goes into effect as presented, as it stood today, drugs would on average reduce by 59%.
Holy cow.
And not just on the privatized side or group side. Medicare was brought up specifically in an interview about, hey, will Part D drugs be affected by this as well? And they said 100% absolutely.
So to me, if that happens, that will make this AEP way crazier and bigger than last AEP.
Correct.
For sure.
1,000%. At the
In
very
a good
least,
way.
Correct.
Yeah.
Yeah. The client will benefit more, but it will, some of the calls where, hey, you can stay put, may end up changing to, okay, we do need to make a change.
Right.
So a lot more quoting, a lot more systems will need to be put into place.
I'm curious how that would all trickle down to the insurance companies if they're getting less cut. What that would mean.
The question is it less cut or is there a
it?
higher margin because we're just removing the person that's adding
right.
cost?
Or would it not affect the insurance companies since it's the PBMs?
Exactly. I think that's part that's still to be uncovered. If it's off a percentage basis, the total percentage would drop and then the insurance company would receive less. But if they receive a set dollar amount on the drug, then that may not be affected.
I'm trying to think insurance companies would have to be for this.
I would think so too. We got a couple questions coming in here. Beck and call. Thank you, Brad. That's what I was thinking about.
Oh, shoot. They tried this in Trump's first term. The courts shot it down, so I'm not holding my breath.
No, that's super fair, William. I think they also mentioned that
Did they really?
The Biden administration had introduced a version of this within the Inflation Reduction Act, and that's the part of the first 10 drugs that'll go into effect January 2026. Those 10 set drugs that they can't maneuver the prices. So there's a version of this in place, but it was only for 10 drugs.
And only for 10 of them.
This is to kind of go after the pharmaceutical companies as a whole and say, hey, we need to get at least closer to what the average is on everywhere else in the nation, because we are paying for so many other countries to have this at a more reasonable price.
William also said there is talk about eliminating the tax on Social Security. I don't believe it will happen, but if it does, it will make future increases in SEPs a lot easier for people to accept. Agree completely. Yeah, I'm not holding my breath on that one either, but that would be awesome. I have like monthly legislative updates with my RSSA.
Yeah.
And I just keep, every time I'm like, all right, are they going to drop some big news? And there's just been nothing. So I'm like, I guess it's good, but it's just, you see all these things on the news. And so it's just hard to know, but some of them, I hope they do happen. Cause it would make, like, eliminating that tax would be huge.
Yeah. I think even if we got a percentage of the benefit that is being, presented would be well received. Sometimes you ask for the full, kit and caboodle, and if you only get the kit, you're still super happy and being happy with that type of win. And a lot of this is being stemmed off of, oh, you're completely okay. A lot of what this is stemming off of is 62% of our nation's bankruptcy is caused by health and medical related aspects. So a huge part of people, even once they get healthy, are not financially healthy in order to proceed or stay healthy. Because off of that, and this is the statistic, I'm a statistics person, I love all these numbers. This is the part that like blew my mind was through all of this, 30% of people who are prescribed a medication say they can't afford to take the medicine that they were prescribed. So they choose or have to choose to not take it. So something that a doctor is saying you need, you're saying, hey, I would love to be able to take that to get better, but I can't
agree with that
it.
statistic very much.
Do you see that in like your clientele?
Yep. When I run their drug list and they see progesterone costs $200 and they're like, I don't have to take it. And, then their spouse is like, yes, you do. And,
slaps them on the arm.
And I'm like, okay, well, here, listen, there's a place, Next RX, and they have it for $23. So like, you can really show your value, but some drugs, like there's not another option.
Yeah.
And so, they're just like, well, I'll see if I can get off of it. And so they do.
Wow.
It's sad.
That is sad. It's a whole other layer. Like this is not just, you're not spending extra money on, baseball games or
no, it's like
adult activities.
They need these for life or death reasons.
Exactly. And I wish that we had a point, and it seems like we may be heading in a better direction to try to make it more manageable to stay healthy. Um, another part that I thought was super funny, that even on the Biden administration through the Inflation Reduction Act, the drugs that were put through those 10 for January 2026,
Mm-hmm.
we still on average as a country pay 2 to 4 times more
What
than
other
everyone
countries?
else's, even for the drugs that are put into this system
Good grief.
that are set to help, mitigate cost for clients.
It's just messed up.
So it's really, really interesting. Obviously, I will be the first to say I'm a huge proponent of anyone doing research. Like, this is for sure an executive order that is set or could affect our industry. And as leaders and advisors of our industry, I highly encourage you guys to do your own research.
Yep.
This just came out yesterday. I'm sure there will be bunches of
Yeah.
activities and news and blog posts. Grab lunch or a coffee with a fellow agent and just kind of go back
Yep.
and forth. You guys will see that this type of stuff can have huge amounts of impact in our industry. So hopefully
I was
this
I
coffee
was
break was
excited
helpful.
when you said that you were researching that. I was like, sweet, you saved me some time.
That's the diet version, because it was like Dr. Oz spoke on it through an interview, and then RFK Jr. spoke on it. The biggest thing is they keep outlining that, like, President Trump can't be bought, and so he does not care if other members that wouldn't have even thought about saying or doing some of the things that he's now attempting. He just doesn't care anymore, because he has a very business mindset of like, even if they say no, no is just no,
No
and
is
then
no.
I tried. So I think it's super interesting to see such a different mindset. So
Well, let's see what unfolds.
yeah. Well,
as long as it's unfolded by AEP.
Yeah, right. Maybe 2 months before, if we can be picky. Well, those were really the questions I had. I know those right now is an ideal time to have, as an agent and an agency, systems and processes in your mindset, making those changes. We're also approaching the quote unquote virtual deadline of hiring someone. If you need to take a look at your clientele with hitting 500, do you have any plans of trying to add anyone to your guys's? I know you have your assistants.
No, just her right now, but she is only part-time, so she might increase her hours.
Gotcha.
But
you'll feel that presence nonetheless. I'm sure.
Yeah.
But we usually generally we recommend towards like the end of June as a hiring. That way you have July and August to train, September to get their toes wet in the field, and then bam, October's there. I mean, AHIP comes out in
don't even say it.
All right.
6 weeks?
Something like that.
Is it 6 weeks?
June 23rd, and today is May 13th. So 40 days.
I have my September already booked up with seminars.
Nice.
So it's not too soon to do that.
Your strategic partnerships and everything?
Yep.
Will that be for your current clients or for new people?
New people.
New people?
Yep.
Nice.
Yep.
That's awesome. That's exciting.
Yeah.
So we're
try to schedule those as early as I can.
Do you have a goal number in mind of how many people you have on your book by the end of this year?
I wanted to gain 150 new ones this year, and I'm at like 60, I think.
Nice.
So I'm hoping
maybe
I can get
more.
150.
Yeah, that's awesome.
Hoping so.
That's super exciting. Well, hopefully this has been helpful to hear some different.
Yeah, thanks for all the questions today, guys.
Great questions.
Yeah.
A Sadie question.
Sadie question.
Do you think that the next 2 years will be... You can't see me, but I exist, I promise. Do you think that the next couple of years are going to be like big trial right sort of years? Because there's going to be a lot of people switching off of Medicare Advantage, and then maybe next year, or I'm sorry, switching from MedSups to Medicare Advantage.
Yes.
And then next year being a lot of trial right of people going
back.
Or do you think people will just stay? I know we can't know.
Yeah.
But I'm just
It will be a
curious.
big trial right year. Yes. Yes. I wasn't even thinking about that. Like your question that you asked earlier, when I think of trial rights, yes, I do think it will be a lot of those. Because again, you're not out anything. I mean, you can try for 12 months, and I think that will be huge to people.
Yeah.
I wasn't even thinking of trial rights. Great question.
Makes you think that all the other SEP options, it's almost a little thankful that we still have access to the FEMA one as a backup.
Yeah.
And we lost, the maintaining DSNP, but for those of you that are in an area where you do have integrated DSNP plans, making sure that clients are aligned with their MCO. I know Brad and I have talked at length about CanCare and what Kansas DSNP looks like. So there's just, making sure you're familiar with all of those different changes. Trial right is a huge one. OEP, I'm sure, will be, how many times did we have this year? OEP was just as busy because we put them on something in AEP, and then before AEP even ended, there was a change. And, had to make sure that these people were still on a plan that was fitting their needs.
Yeah.
So, wow. A whole bunch of changes to be coming up near future. It wasn't really
but
great
shows
English,
our
but
value so much. Like, if anything
True.
of these like stressful calls I've had with clients, they have been overly grateful.
Yeah.
And like verbally about like, gosh, I just don't know what I'd do without you. So like these changes are hard and they're stressful, but we're just strengthening our relationships.
You're
with our
making clients for life.
Yes,
Through
for sure.
the hardest of times, the outcome of that is almost always,
Yeah.
if you can help someone through this, you can help them through anything.
Yeah,
So
exactly.
that's super exciting. Well, thank you for giving us a little
thanks for all the good
taste
questions
of the,
and your
what
research.
you're doing. Yeah. I was having way too much fun listening to all these different less than fun morning topics.
Yeah.
Something about statistics.
Gave you some
and everything
statistics,
like that.
right?
But yeah, that's going to wrap us up here today. If you're not already a member of our Medicare Cafe Facebook group, I highly encourage you to join. We've had a couple of members on there, specifically a shout out for Chris, who has brought some amazing questions and actually just had a conversation with him last week talking about a couple things that were affecting him and his agency. So if that's something that interests you, please consider joining us. And until then, I guess it's that time.
That's right.
Because you go second. I don't know if I know the first one.
Have
I
fun.
always. Oh,
You say have fun.
Okay, I can do
Or
that.
I'll do have fun.
Make money.
And give impeccable service.
Thanks, guys.
See ya.